topic for today's discussion is thin endometrium. What are the causes and how do we tackle it? Very often you might find your physician telling you that your endometrial lining is thin. But thin is how thin? Do we get pregnancies at endometrial lining which is less than 7 or less than 8 or what? Ideal lining that your physician is trying to see is anything at 8 millimeters and above, but up to a maximum of 12 millimeters. Having an endometrial lining of this thickness is likely to increase your chances for a pregnancy. Whilst any kind of lining which is less than 8 mm does reduce your chances, but we have seen that linings even at 6 and 7 mm but with a very good morphology has resulted in a pregnancy. So what are the likely causes whereby one may have a thin endometrial lining? Your physician will also try to find out the cause for the same. He or she may therefore recommend a diagnostic hysteroscopy for you. That is the time that your physician will try to find out if you are having a uterine cavity which is smaller than normal in size, which is resulting in a thin endometrium, or if the walls are very narrow, thus indicating that one may require to do what is known as lateral metroplasty, or to cut across the walls so as to increase the cavity size. Certain times, if there are adhesions that are seen even at the top of your uterus, which is termed as the fundus, one may require to do surgery so as to increase the size and the volume of the uterus so as to get a better lining. Your clinician may, in such situations, recommend you to be on continuous estrogen and progesterone tablets so as to make your uterus develop a normal lining. Having got the confidence or obtained the confidence that the lining is now good, he or she will then plan your frozen embryo transfer. So often in such situations, your physician divides your IVF cycle into 2 parts, wherein at the first attempt, your physician will form your embryos by giving you gonadotropin injections, then doing a retrieval, forming the embryos and freezing them. He will then, and the second part, start preparing your endometrium so as the endometrium is ready to receive the embryos. We also see that in IUI cycles, we have patients who have thin endometrial lining. In such cases, often it is the oral ovulogens that are prescribed to you that may cause the thinning of the uterine lining. However, it is very often observed that by the time your follicle gets ready, the lining does come up to at least 7 to 8 mm, when your physician will then give the trigger shot or the HCG shot so as to achieve the final maturation of the egg and plan the IUI or the intrauterine insemination. At times, patients give a history of tuberculosis in the past. These are patients that often need to be investigated, need to be checked, and a diagnostic hysteroscopy is a must so as to rule out the cause for the thin endometrial lining. Patients who have repeated abortions and who have undergone dilatation and curettage or a DNC in the past may also show signs of thin endometrial lining. At times, their lining may also show some irregularity, which may suggest presence of adhesions within the uterine cavity. Your physician will then post you again for a hysteroscopy to confirm that all is normal. Do an adhesiolysis if required, that is, cut the adhesions that are present within the uterine cavity so as to make your uterine cavity normal, and then plan an IVF cycle for you. I hope that this has been helpful in your understanding of why a person may have thin endometrial lining, and I hope that you are able to discuss this with your physician for the same. Thank you.